Because I would like to introduce you to Nithya Solomon, who is a health innovation executive known for shaping transformative initiatives at the intersection of technology, health and social impact. She is the director of RMIT's Cisco Health Transformation Lab, where she drives cross-sector collaborations that reimagine health systems through advanced prototyping and design. Her career is global. You've got the agenda on your desk and you can have a look at her bio there. But Nithya is here to launch for us a very special report from the NIIN Health Alliance, and I'm going to just hand over to you, Nithya, to take us through that. Please welcome her.
Thank you. Thanks, Catherine. Thanks to Flinders, an architect, for this amazing event today. Yes, beyond trends and towards adoption. So as Trish so brilliantly set up, really the health system right now, and many of us live this day to day, is at a very interesting crossroads where we have demographic trends, we've got systemic strain, we've got rapid technology acceleration that are all converging. And in this kind of environment, change is really urgent and critical, yet the transformation process is hard. In these times, innovation, yes, but more specifically collaboration is not so much a nice to have or optional. Really would challenge you to think about how collaboration is absolutely essential to making progress. And particularly in these times, the question is no longer whether transformation is really necessary, but how it can be achieved responsibly, sustainably, and at scale. And it's precisely this set of dynamics that led to the creation of the National Industry Innovation Network, NIIN, and Catherine described a little bit of how that works. It's anchored by Cisco, but really it's a network that's driven by government, by industry, by universities, and a really powerful way of working in a network system. And now within the NIIN, there is something called the NIIN Health Alliance. The NIIN Health Alliance is now Australia's premier multi-university network for digital transformation in health. There's a lot of small print on this slide, but it really speaks to some of the intricacies within this system where we have research excellence, we've got academic insights really coming together with clinical oversight, with technology advancements. And in this kind of a network, ideas can really flow from the lab to the clinic in ways that really make a difference for patients, for clinicians, for providers, and more broadly for the health system overall. So it's a really powerful way of coming together. The NIIN Health Alliance is now, in only a couple of years' time, has more than 24 sites in Australia and also Asia Pacific. Collectively, we have mobilised around $11 million or so of co-invested funds. We also have more than 20 industry-partnered projects and pilots out there. So all of this in a short space of time. This is a picture of some of us at Cisco Live in November, which it was in Melbourne, attended by more than 6,000 or so people, and a great place for us to showcase increasingly the strength of the NIIN Health Alliance. One of the other things that we showcased at Cisco Live this year was the launch of the Health and Digital Transformation Report, the 2025 to 2026 edition. There's a QR code there, which I'll bring back again in another couple of slides, but would really encourage you all to access it and look at the content. This is the second report in a 3-year series, and this really shows what the NIIN is observing to be a very pivotal moment really across the Asia Pacific, where we've moved beyond observing trends and we're very squarely in the level of practice that's really about adopting trends, about showing impact. Real-world pilots, real-world collaborations, real-world activity. There are 13 or so of these case studies that we present in that report. They're all collected from across the NIIN Health Alliance and really show how together as a community and a network that NIIN is really advancing some outcomes forward, and particularly focusing on 3 domains that the NIIN Health Alliance has prioritised, which is around improving patient outcomes, it's around strengthening built and digital infrastructure, and it is around improving finding ways to uplift workforce capability. Again, there are 13 of those case studies. There's about 7 or so in the zone of patient outcomes, so really interesting examples of how AI is being used in everything from childhood dementia improvement to, call centre triaging and interesting examples like that. We've got 2 examples of skilling approaches and one of those I'll play you a short video on in just a moment, around digital skills training, around rapid upskilling, some of the examples that Trish highlighted around in the built and digital infrastructure space around cybersecurity, and other pretty exciting demonstrations that you've got out there as well. So I would really encourage you to have a read of all of these in that report. And I'm just going to play you a very short video to give you a sense of how nuanced each of these pieces of work actually is. This is the skilling initiative that was conducted at Grampians Health last year to rapidly upskill a range of their staff on digital health. It's definitely a time of huge digital transformation in health. And it's a real challenge as to how you can skill your workforce fast enough to be able to really tap into the technology and all of its benefits.
It's really important to uplift digital skills at Grampians Health. We've got a really big digital transformation journey ahead of us, so need to uplift and train now to be able to support our future as well and how we deliver quality, safe patient care.
So with this training, we've come up with a solution which is 5 short courses that allows learners in the healthcare sector to study at their own particular pace and it allows them to kind of work around their particular job. Because they're digital products and are scalable, we can kind of branch those out to any particular hospital.
The demand for these skills with the staff has been so overwhelming. The response has been really great, and that's been across every sort of department of the organisation.
The biggest benefit for me in upskilling is the use of technology to deliver timely care and the best care to the patients. We're here to improve patient outcomes and have patients hopefully leave our organisation better for the experience, and any technology that we can use to help that will be a massive advancement for us.
There's been a tremendous amount of research, evaluation, feedback to make this program really a quality product. It's going to make a real difference for the healthcare worker in this country.
Great. I'm going to cut the trailing end of the music off there in respect of time, but really just one example of how, thanks to the networked connectivity within the NIIN Health Alliance, collaborations that involve hospitals, that involve Cisco, Net Academy curriculum, universities can really come together. So there are 13 of these types of case studies across the NIIN Health Alliance now. And looking forward, there's even more of a program of work where we're really looking forward to more intelligent AI examples, more workforce skilling, more digital infrastructure, more capability enhancement. And actually in that report, the QR code is here again. There's even contact details. So as a NIIN Health Alliance, we really want to foster a network where we can collectively move the needle forward. And so we're really encouraging everyone to come and join us and find ways to connect with us. We want to connect with you. So please do reach out to us. And together we are really hopeful that we can create some of these resilient and equitable futures that we all want to see. So thank you very much and look forward to speaking more.